this is no longer a public health-led matter. This is a whole island challenge led by government, supported by the community and advised by public health. The change in our lineup before you today consciously reflects that shift. And I want to take this opportunity actually to thank the hundreds of individuals represented by a few here today across the whole public service who have worked and quite literally around the clock to gear us up so that we can support our colleagues in health services who are about to be put through their paces in the weeks ahead. Now, at 7:40 p.m. last night, we had 157 tests with only one positive. We have no evidence yet of community seeding of the infection, which of course is great. It's great news. It means that we remain in the contain phase of our plan, which of course is to isolate cases, undertake contact tracing, and quarantine the close contacts. At the same time, all around us, the number of cases is rising rapidly, and Europe is now the epicenter of this pandemic. This means that the World Health Organization assesses that many countries will now see full-blown outbreaks with sustained community transmission, such as has happened in South Korea and Italy, and obviously a number of other countries now. And this is why we are seeing increasingly draconian measures being taken in jurisdictions around us. And unlike SARS a few years ago, this outbreak will continue for some time, weeks or months in the initial phase, but maybe a year or more overall. The World Health Organization identified one key reason for the rapid spread. Many countries had not taken the situation seriously enough, what the World Health Organization called alarming levels of inaction. Here in Guernsey, Dr. Brink and her team have all along taken COVID-19 with the utmost seriousness. But despite that, we now face the gravest public health crisis since 1944. We cannot hope to keep this infection entirely out of our community. That is totally unrealistic given the pandemic nature of this infection. We cannot completely cut ourselves off from the outside world forever. But we have effectively imposed a temporary travel ban, which, as previously anticipated, I'm now announcing that we are further tightening. From 1 minute past midnight on Thursday the 19th of March, any entrant to the bailiwick from anywhere outside, including Jersey in the UK, will be subject to a 14-day period of mandatory self-isolation, subject to limited exceptions. And Dr. Brink will explain the rationale and evidence base for these imposed travel restrictions, the timing of its introduction, and the basis of the necessary exceptions. I'm also announcing today, again as pre-warned last week, the imminent intention by the Civil Contingencies Authority that met today to adopt emergency powers regulations, and Deputy Salisbury will outline what these will do. What else must we do? First, because COVID-19 will be with us for a long time, there are baseline things that every islander must now get used to, like practicing frequent and effective hand washing, adopting new social greetings and discouraging large gatherings, and generally maintaining some physical distance from one another, especially for those over 65 with underlying health conditions. These measures alone will reduce the number of cases by 60%. And that is why they are so important, and everyone, young and old, must comply. It is not about protecting you, it's about protecting others. Second, we need to prepare for our own peak in COVID-19 cases. If we have even moderately large numbers with our finite on-island resources, our health system will quite quickly become overwhelmed. The consequences of that is that more individuals will die than would be the case if they could all receive the best available treatment. But we now know that the majority of patients, in fact 80% of them, only experience mild symptoms and can very satisfactorily recover in comfort at home. The ones that are most at risk are the elderly and those with pre-existing conditions like high blood pressure or lung problems. So we will only hospitalise the most serious cases. And this way we can focus resources on the seriously ill, speed up our response time and hopefully minimise the number of deaths. If there is a peak, we will probably also need additional social distancing measures. These will be temporary, like closing where we are today, Beau Sejour, the schools, restaurants, bars and other public spaces, and possibly compulsory home working. These measures, if imposed, will be extra brakes to slow down transmission of the virus, prevent our healthcare system from being overwhelmed and help bring the numbers back down. After the situation improves, we can ease off and go back to the baseline precautions. But let me emphasise this. Today, the situation in Guernsey remains under control. We are not locking down the community like the French, Spanish or Italians, quite simply because we don't need to yet. What we are doing now is planning ahead for some of these more stringent measures and preparing islanders for when we actually do need to deploy them. And islanders should assume that at the right time we will need to. It's quite possible that we will see school and other closures in the UK, Jersey or other jurisdictions, and it's quite understandable but inappropriate for our community to be looking to other places as a guide for what our island needs at this stage in the disease's progression. With the internet it's hard, but islanders really must ignore what's happening elsewhere and rely on gov.gg as their source of reliable information and guidance for what's appropriate in Guernsey. Please do not spread gossip or information sourced from social media. It's really not helping anyone. One major concern we have is the impact on our economy. Our business community is suffering big time. And so the states are working on a package of measures to assist immediate liquidity problems. I will announce this initial package in the States of Deliberation tomorrow to help businesses cash flow and keep their heads above water. And more detail and quite possibly more measures will be required in due course. And I'm not going to say any more about this today. I'm saying all of this today to reassure the community that we are in control. We've got a good grip and we're thinking one step ahead. We've anticipated the health, service and economic consequences and have planned accordingly. We have and will continue to make judgments which are informed by the most recent and best scientific information and evidence that Dr. Brink and her team can supply. The steps we take will be proportionate and relevant to the bailiwick's needs. Islanders will quite understandably be anxious for themselves and their families, but they need not be fearful. Most of us will be able to continue working, shopping and going out with a very large proviso that public health's advice must be rigidly complied with, particularly in relation to personal hygiene, hand washing, not touching your face, catch it, kill it, bin it, and of course social distancing. As a community with huge resilience, and we have some tough times ahead, we will get through this. I am, and I know as others are, hugely humbled and impressed by the rallying of islanders to support each other and taking a really responsible attitude by the vast majority to the public health advice that has been issued. We will remain in this high-risk state for some time to come. But there is only so much that government can do to plan and prepare. The success of this plan will largely now come down to the individual's actions of quite literally each and every member of our community to comply with the advice that we have given and that we're obviously going to regularly update as and when needed. The responsibility on each one of us is huge. But if we all remain disciplined, follow the practical precautions to protect ourselves and our family, we will be able to keep our economy going, and we will be able to maintain a semblance of new normal daily life until the crisis is finally over. So that's enough from me in terms of opening, and over to Heidi.
Thank you, Gavin. I think it's important that I repeat just a couple of things that Gavin's just said. Firstly, that we have had 157 tests and still only just one positive result. We're not hiding anything, and the up-to-date figures will be provided on the website. Secondly, that we are in control. We have a good grip and we're thinking one step ahead. Now, this is no small measure down to the hard work and effort being undertaken by all those working for us. It's a strength, quality and dedication of many, both in and outside the States of Guernsey, that is keeping us in a good place. From senior civil servants to the Health and Social Care Estates team, from the States of Guernsey Communications team to our partners in health and care, the community should have assurance that every effort is being made to ensure that we are prepared for the weeks and months ahead. However, we can't do it alone, and we'll only have a chance of being able to cope if we work together. We as a community have to step up to the plate too. It's important that we all heed the advice of Dr. Brink and her team. And the reality is, that's what the vast majority of us are doing right now, ensuring we up our game when it comes to basic hygiene, finding alternative ways of greeting instead of shaking hands, and maintaining social distance. Others have been self-isolating, and yet more have been offering to support our more vulnerable members of society. Thank you, one and all. However, sadly, there has been a very small number of people who have been ignoring public health advice. This selfish behaviour is deemed completely unacceptable, putting the lives of others at risk, and we can't allow that to continue. As such, the Civil Contingency Authority will imminently be approving regulations providing emergency powers. These will allow the Medical Officer of Health, who currently acts also as a Director of Public Health, her deputy, and others authorised by her to enforce the testing, isolation and/or detention of those who travel to the bailiwick. It will also allow the enforcement of testing, isolation and/or detention for anyone in the bailiwick suspected of being infected. The Medical Officer of Health intends to require all those travelling to the bailiwick who are not considered to have critical roles to self-isolate for 14 days. The powers also allow bailiwick law enforcement officers to initially detain at the hospital or another suitable location someone that they suspect may have the coronavirus and present a risk of spreading it to others until the Medical Officer of Health can advise further. Not complying with the restrictions or requirements imposed under these powers will be an offence, and we'll be looking to introduce statutory sanctions for people who don't comply. This is not a decision that has been taken lightly. However, the fact that these emergency powers have been enacted demonstrates the seriousness in which we take this issue. This is a time when we must all support each other for the good of the whole community. We are all in it together and must support each other through these extraordinary times.
So thanks, Heidi. So Nikki, perhaps a bit of an update.
So thank you very much, and I, like Deputy St Pierre and Deputy Salisbury, would like to say thank you so much to the community for the amazing support we've had. We've really been overwhelmed both within public health services but also wider health and social care about the amount of support we've had, and it's truly, truly appreciated. I think from the start it's fair to say that we've taken COVID-19 and infection with SARS-CoV-2 very seriously, and I think that's important because the World Health Organization has said very clearly that we need to design a program that is right for our jurisdiction. So we've taken Guernsey, the population of Guernsey and Alderney, what infrastructures we've had, the aging demographics, so we've taken all of these factors into account when designing what is right for Guernsey. And I think that's really important. So I think from our point of view is that focusing on the identification of cases, looking at contact tracing, quarantining measures when required, the more recently introduced program of social distancing, the infection control measures are so important. And one of the comments, and these are the positive things of coming that we've had from someone in another jurisdiction, has commented about the use of the word social distancing. And that's really interesting because they commented that we should perhaps be using the word physical distancing. So we want to retain our social connectivity in which it's going to be really challenging times for all of us on the island, but have that physical distancing to try and prevent transmission. We've also tried to continue to provide you with an evidence base to our decision making. We've tried to share that openly and transparently with you. So, for example, the advice to restrict travel into the bailiwick comes on the basis of evidence. So we've calculated, as from this week, the risk is about one case coming in a week. That will increase exponentially as the weeks progress. So we felt it's very important to act proactively and early to protect the health of our population, and we feel that these measures are therefore proportionate to the risk we're facing.
Great, thank you very much.